Now, you have these pads.
Is there a razor blade in there?
Oh, yeah, there's a razor. Absolutely, sir. It's a very expensive dollar store Bic. And let me tell you something. They have medical ones for a lot more. Just go to the dollar store and get a Bic. After you do that, turn it on. This is how we turn it on. It's going to make some noise.
Stay calm. Follow these voice instructions.
Now, this is the real live deal.
Now. Begin by exposing.
Now, you wouldn't normally do this, but I want to put this in here so we can use it.
Make sure pad connector is plugged into AED. Make sure pad connector is plugged into AED. Make sure pad connector is.
It is connected.
Do not touch patient. Analyzing heart rhythm.
Clear.
Please wait. Do not touch patient. Analyzing heart rhythm. Please wait.
How does it know the heart rhythm? You put it
You're going to put these
Do
two
not
pads
touch
on there.
preparing shock. Move
Okay.
away from the patient.
All you've done is you put the two pads on and you're standing
Preparing
back.
shock. Move away from shock. Move
Clear.
Delivered in 3, 2, 1. Shock delivered.
All that's
It
going to
now
happen is
safe
this,
to
folks.
touch the patient.
Chest is going to come up.
When instructed,
and then come down.
give patient 30 rapid compressions. Then give 2 breaths. Place heel of
Now,
one
watch
hand
what it
on
also
center of
does.
chest between nipples. Place heel of other hand directly on top of first hand. Lean over patient with elbows straight.
Just listen to it.
Press the patient's chest down rapidly, 1/3 depth of chest. Then release.
He's a little wordy.
Start CPR. Press, 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 press.
I can't have you keep doing that.
Press, 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 press.
It's like Chinese water torture. There's a way to make it go beep, and the person that I work with hasn't changed it yet. So
Continue CPR. Continue with compressions.
yeah, I know.
Press, press, press.
There we go. My point being is, was that pretty simple?
Yeah.
I realize, and I go back to what you're saying, if you actually have to do this, you're going to be scared out of your mind.
Yeah.
But you have to take a step back. Yes, Chris?
You only shock them once?
No, that's a great question. After 2 minutes, it's going to reanalyze. If it has that shockable rhythm again, it will do it again. It will keep doing it, but that's why this particular brand I think is a little bit better. It will give it will increase the shock. So if it starts at 150, it will actually work its way up. Now, to that point, there's 2 types of pads that you need to know about. There's adult pads and then there's infant and child pads. The adult pads can go on anybody. Infant and child pads can only go on infant and child. And the reason being is it will only give between a 30 to 60 joule charge. Where it will go with graduated charge, but it'll only give that small charge. That's not enough to stop a person's heart, an adult's heart. Now, for those of you that don't know what an adult is in terms of CPR, it's anybody over puberty is considered an adult,
Regardless of size.
regardless of size. So, okay, so the CPR, that's a great question.
So
They
the
can't
scissors
talk.
but the
Now,
scissors
how old is your daughter?
It's about to turn 14.
Exactly. So she's right in that in-between stage, like, oh my God, I don't know what she is. The way that you define puberty, breast development in girls, underarm hair or facial hair on boys, if you're not sure, you put the adult pads on and you just do it as an adult. Now, the only difference between the adult and the child are a couple of things. One, you use one hand. That's it. So if you're going to do hands-only CPR, you just use one hand. You can switch hands, and if you get tired, you can still use 2 hands. The main thing is you want to keep that engine primed. The other thing about children that you need to know, most children don't have the pleasure of eating all the tail and mac and cheeses they want and clogged arteries and everything else like we do. So it's not usually a cardiac event that they're dealing with. It's more of a respiratory event that causes the heart to stop. So that's why we really want to get that AED on them a lot quicker. So in a child situation, if you see it and it's witnessed, you try to get that AED first, put it on. In the adult situation, you do your 2 minutes of CPR, and then you go get your AED. The reason we do that is we want to keep that engine primed. And that's what this is all about. Does anybody have any questions on the AED? Yes, ma'am.
2 questions. So you said the adult pads can be used on anyone. Is that like infant too?
Infant as well. And what you would do is you would sandwich them. You would go pad, baby pad. It would go front and back. You can do that on the child. Ideally, you would want to do that in the adult, but the reason we don't is because you can't move the adult. So you would go here, which is the clavicle to the nipple, and then right to the side, right here. Does that make sense? Now, after you do that, it'll keep shocking if it has a shockable rhythm every 2 minutes until help arrives. Once help arrives, don't just say, okay, I'm done. They may want you to stay and do something, like continue CPR while they set up. Because what's going to happen is you're going to call 911, police are going to come first, hopefully. Hopefully they have an AED and they can do what they need to do. Then maybe the fire department / EMS will come. Paramedics will come from the hospital. Greatest thing that ever happened in the world. It's a mobile hospital. They're going to transport them in New Jersey. Most of your places are volunteer, thankfully. Put them into the ambulance, bring them to the hospital with the paramedics, which are sponsored by the hospital. Now, depending on which hospital you go to, you're going to get great care either way, because I think we have some of the best hospitals in less than an hour radius. Right down the road. It's a level 2 trauma center. That's where the president would go if he was in this area. If he doesn't go there, he goes to university, which is a level 1 trauma center, which means that they have every single surgeon that you could possibly need or want right there. Oh, if it's a burn, we go to St. Barnabas. We're very spoiled, and I mean that in the most wonderful way in the world. And because of that, because we're in such a upper middle class and middle class area, people demand the best. That's why AED sales are so important, not to the bottom line, but to saving lives. You were talking to me about St. Pat's. There's a long history of unfortunate things that have happened at St. Pat's. Child died. Parent is passionate about AED sales. Same thing happened in Millburn. This was not last year or a year before. This was 10 years ago that they were passionate about it. The reason why I am, my father died when he was 50 years old. I was 13 years old. Went to the hospital, didn't come out. It was unfortunate luck. He had a 75-year-old heart for a 50-year-old man. That's why I do what I do. Does anybody have any questions on the CPR or the AED piece?
No, I'm sorry, I'm being.
You have 2 more and you're done. You can ask as many as you want, Pam.
You explained how this wonderful automatic one works. What if you're in some place and you go, they bring the thing, it's not automatic? What's
The only difference is this light right here.
So it still does the sensing of
It'll do everything
of
exactly the
everything
same
else.
except for
So
the
you actually
light.
have to push the button.
Now, the difference is, Pam, I'll press this button all day. It's never going to do anything until it finds a shockable rhythm and it's on. And it says press button.
Okay.
Okay? Now, when you press that button, you better make sure everybody's clear. Because if you touch that patient, you could die. And I don't say that lightly because it's stopping the heart. Because what's happening is your heart is beating so fast that it's not actually pushing any blood out. Now, did your daughter ever hyperventilate? No, because she's strong like you. But do you ever have anybody that's ever hyperventilated before? Ever seen that before? Person can't catch the breath? I'm going to let you in on a little secret. It's not a medical emergency. Because what happens? You go to the nurse's office if you're in gym class, they give you a paper bag, tell you to calm down, then you go back, right? But the same principle is happening to your heart. Your heart's beating so fast that you can't actually push out blood. So what this AED does, it recognizes that, stops the heart. And it's hoping that your brain and your internal ticker will go back to its normal rhythm. Now, if it was that easy, everybody would be alive and everything else. There's a lot of other factors that go into that.